morning. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin diseases and allergies, and as host of this program, I'll take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer will take you behind the sterile and closed doors of the operating rooms of the Fremont Medical Center in Yuba City, as we meet with one of Northern California's most respected surgeons, Dr. Charles Rossen. This evening, Dr. Rossen will show us a technique that allows surgeons to look into the human body and perform surgery without the need for large openings in the skin and abdomen and without the need for long hospital stays. Tonight, Dr. Rossen will show us an actual gallbladder removal as he uses high-tech video and fiber optics to show us inside the abdomen of one of his patients as he carefully removes a diseased gallbladder. This is the first time that this procedure has been shown on local television, and the view is fascinating. In the pharmacy corner tonight, our award-winning neighborhood pharmacist will tell us about a new medication that can help you quit smoking. Is there a way to decrease your urge to smoke without taking pills or having to use nicotine chewing gum? Well, we'll learn the answer to this question and others about nicotine patches in the pharmacy corner tonight. Tonight's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topics tonight, let's take a look at the latest medical news. A new study has concluded that Retin A cream can help fade away liver spots. Researchers found that the prescription cream that is widely used to treat acne and aging helped to lighten age spots in 80% of the people tested. In a dramatic series of photos, the researchers showed a woman's aged, wrinkled hands covered with brown age spots. After 40 weeks of treatment, the spots were nearly gone. The Retin A works by blocking the production of melanin. The study was reported in a recent issue of the New England Journal of Medicine. Lightening of the spots began after 1 month, but the best results occurred after more than 6 months. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's most respected pharmacists. Returning tonight to our pharmacy corner is our award-winning registered pharmacist, Bob Church, from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you. It's nice to be here.
It's always a pleasure to have you here. Thanks.
Thank you.
On previous Medical Explorer programs, we've talked about ways of delivering medications to the body without taking pills or using intravenous medicines. This new drug delivery system uses a skin patch to get medicine into the body. Recently, a new patch has become available, which seems to be creating quite a bit of excitement. Bob, tell us about it.
Well, I think for a long time smokers have been trying to find a way to quit smoking, and we've seen a lot of things happen. We've seen the development of smoking filters, we've seen the chewing gum. All of those techniques were adequate to a degree, but never really gave a lot of promise. Now we have nicotine in a patch, and we've talked about patches before as a way to deliver medication. I have never seen a new product take off like this product. The interest in these nicotine patches is tremendous. In fact, at the time that we are recording the show, we can't even get the patches now.
That's amazing.
Yeah.
There's 3 companies making them, and
there's a
delayed.
4th one that's going to have their product out within a matter of weeks, and the demand is so great they can't meet it.
How does the patch actually work?
Well, the patch works like any patch that delivers medication. There's a delivery system designed within the patch to release the medication over a 24-hour period so that you get a steady blood flow of the medication, in this case the nicotine. With the gum, it was you had the nicotine in your body at a peak when you were chewing the gum, and then when you parked it in the side of your mouth, the level of nicotine went down in your body. So it was adequate to a degree, but this is much more refined.
Now, people may say, well, there's nicotine in cigarettes, and you don't really want people to smoke because there's nicotine in cigarettes. Why would you want to have nicotine in a patch? What's the difference?
Well, the difference is what you're trying to do with the patch is handle the withdrawal from the nicotine. In other words, the nicotine takes the place of the cigarette. You have the nicotine, but you don't have all the other carcinogenic products that are in the tobacco smoke. The patch was never designed to be used by itself. It was designed to be used in conjunction with a smoking cessation program, so that the patch deals with nicotine withdrawal, the program deals with the behavioral and environmental influences that affect you when you're a smoker.
So when you're smoking a cigarette, it's the nicotine in the cigarette that makes you get hooked on the smoking?
That's correct, absolutely.
So if you just have a patch with one chemical, it's better than smoking with 1,000 chemicals, which has all those cancer-causing things.
Absolutely.
And nicotine doesn't cause cancer.
Not that we know of.
Right, it does not. So it causes the addiction and some heart
That's
changes,
the drug that causes the addiction, absolutely.
So we want to get people away from that cancer-causing situation.
That's
Great. Now we know these are in several patches. How do they play a role in the treatment? Does the patches come in different strengths and forms, and how does that work out?
Okay, in the clinical trials, the way this thing was set up and the way it's supposed to be handled is there are 3 patches. One is stronger, medium strength, lowest strength, and there's different strengths depending on the manufacturer, but that's the way it works out. What you would normally do for a healthy individual would be to start on the highest patch and run it for anywhere from 2 to 4 weeks. Then drop them down to the intermediate level patch for another 2 to 4 weeks, and then again to the lowest strength patch. And by that, over a 3-month period, hopefully, you have completed the course of therapy and they're off the cigarettes, and hopefully they're going to stay off. If you do it that way, and if you're involved with a smoking cessation program, the results can be as high as 70%. So that's really, really good.
So you wouldn't expect to stop smoking immediately?
Yes, what you want to do is when you start the patch, you want to stop the cigarettes. The studies all showed that if you're still smoking after the initial 4 weeks, you might as well stop using the patches because you're not going to make it.
Now, I bet with all the publicity on this that patients are just calling their doctors. In fact, we see that here. We get calls every day now, 2 or 3 patients asking us just to write the prescription or call the pharmacist.
Absolutely.
We should really be asking the patients a little bit about their health background before we prescribe these things, shouldn't we?
Sure. The course of therapy is going to be dependent somewhat upon their medical situation. People that are cardiovascular patients, or people who, let's say, weigh less than 100 pounds, or those who smoke less than a half a pack a day, should really start out maybe on the medium strength patch and go from there, not start with the highest patch. So yeah, there's some considerations. It's not something you're just going to write a prescription for and give it to them.
And some people may be on the higher dose a little bit longer before they go to the lower doses, and they may be on the medium dose longer before they get to the lowest dose, and so it's got to be individualized for people.
That's correct. It's not a cut and dried thing.
Right, so it's not like here's the nicotine gum and try it 5 times a day or whatever you do every hour. It's a lot different.
Yes.
Now I had a patient, believe it or not, get these nicotine patches, and every time he thought he had an urge to smoke, he would rub the patch thinking that that was going to be the way it would work. So what happened is he rubbed this patch and it gave him a big rush of the nicotine going into his bloodstream, and it made him feel bad. That's not the way the patches work, right?
No, the patches don't work like that.
So as the patch is on the skin, it's delivering a constant amount of medication.
That's correct. That's correct.
What could be side effects of the patches? What would happen?
There really aren't a lot of side effects. I think the most noticeable thing might be when you put the patch on initially, you might get a little stinging, burning, or redness of the skin when you take it off. None of those are to the point where they should discourage you from using the patch. Most of that will go away within an hour or 2. If you continue to smoke, then you may get some overload of nicotine and get things like headache, nausea, nervousness, vomiting, that type of thing.
Most people would get used to these things, I would assume, after a period of time.
Definitely.
Who should our viewers contact within the community for information on smoking cessation programs to help them with this?
I'm glad you asked that, because what I am seeing at this point is that people are getting the patches, but they are not being referred to smoking cessation programs. And they really need this to give themselves a chance of really getting off the cigarettes and making it work long term. Sutter County and Yuba County Health Departments both have smoking education programs where they do smoking cessation programs. The American Lung Association has them available, and the Cancer Society. So if you call any of those folks, they can tell you when those programs are run, and they are run on an ongoing basis. So you may be in the middle of one now, but in 2 or 3 weeks there may be another one starting. So.
Great, very good. Bob, as usual, that was very useful information, and I hope that our viewers will discuss their concerns regarding these nicotine patches with their pharmacists and physicians very soon. We certainly look forward to you appearing again on our program, and thanks for being here tonight.
You bet. Thank you.
My pleasure. Now, on with the Medical Explorer. One of the most common operations performed in the United States is the surgical removal of the gallbladder. Until the development of the new fiber optic technique, gallbladder surgery would require large openings to be cut into the abdomen so that surgeons could reach under the liver to the gallbladder. Tonight, our special guest will show us an actual gallbladder removal performed through a telescope-like device that is a major breakthrough in this surgical procedure. I'm now pleased to introduce you to tonight's special guest, one of our area's most respected and well-known physicians and surgeons, Dr. Charles Rossen. Dr. Rossen, I have to say I'm so delighted to have you on the program tonight, because over the years we've done these shows for 8 or 9 years, and people write to me about guests that they want to have on the program, and they've been writing to me for years trying to get you on the show. And your schedule is always so busy, it's been hard to get you to come over, but I know you had a cancellation coming up here, so we were able to fit this in today, and I really appreciate that. Thank you very much.
You're welcome.
I always like to begin by having our guests tell our viewers about their educational background and training. Can you tell us a little about yourself?
I attended the University of California, Davis for approximately 6 years. Then entered medical school in 1960 in San Francisco, University of California. Interned at the county in San Francisco, and then spent another 5 years in residency at the University of California in San Francisco, and came to Yuba City in 1970, and have been here ever since.
Quite a lot of surgery during that time. You've seen the insides and outsides of probably more people than more than anyone else in the community, and that's for sure. And I know you have a tremendous reputation. I'm so glad you're here. Thank you.
Thank you.
Our viewers hear about their friends and relatives having gallbladder surgery quite often, and most people aren't really aware of what the gallbladder is doing. I know you're going to discuss that a little bit during the surgery today, but what is bile and what is it doing in the body and that sort of thing? What goes on there?
Well, very simply, bile is made in the liver, and it's stored in the gallbladder. So the gallbladder functions primarily as a storage organ. When you eat food, particularly fatty foods, there's a hormone that's released, and it circulates in the bloodstream and causes the gallbladder to contract, and the bile is then emptied into the duodenum, or the small bowel. And there, the bile, along with everything else, helps emulsify or digest the fats. The gallbladder is, when it's diseased, has gallstones, can be removed, and then the liver takes over the function of not only making the bile, but also storing the bile.
Great.
And so really you don't need your gallbladder.
How would a patient know, or what would they experience if they were having gallbladder problems? What symptoms?
Usually the first thing that catches a patient's attention is pain. Some sort of discomfort in the upper abdomen, principally the right upper quadrant. The liver and the gallbladder are located under the right costal margin, the rib margin,
rib cage,
under
right?
the rib cage.
Mm-hmm.
And usually it happens after a heavy meal, so evening is usually the heaviest meal, and it's very typical that after you go to bed, after you retire, you might experience discomfort. You might get up and take an Alka-Seltzer or some Tums, and that doesn't help, and you have a dull ache, and that usually passes. And what's happening is that the gallstones that have formed in the gallbladder are trying to get out with the bile that's been placed into the intestines to help emulsify the fats, and it might get stuck, and it causes some colic, much like when a person passes a kidney stone, and it can become very painful. Sometimes one of these stones gets stuck in the little cystic duct, and that produces an extreme amount of pain. Visceral pain is not handled well by anyone and will frequently result in, if it's severe enough, the patient will call the physician. And then that's how the diagnosis is made. We now have methods using ultrasound to diagnose the presence of gallstones.
And our viewers should realize that you as a general surgeon are considered the expert on being able to talk to a patient and diagnose what's causing a stomach pain or an abdominal pain.
That's correct. The other physicians can do the same thing, but if the gallbladder needs to be removed, they would call a surgeon.
Right. I know that also during my medical school training that when it came to the diagnosis of what's causing stomach or abdominal pain, the surgeon was very good, and I know you're good at that too. You're being modest, but that's okay. You've brought some instruments here to show us that are used in your procedure today, and can you show our viewers what you have here and how this is done?
Well, first I might show just a picture of what you're going to see is the camera inside the abdomen with the liver and the gallbladder. The gallbladder is green,
right.
And you can see it right here. And then to get into the abdominal cavity, and this is the abdomen here, we use these instruments, a little trocar, and these are pushed into the abdominal cavity, and then the camera and light source pass through this opening and into the abdominal cavity, so that you have this light source passing through this instrument to give us the picture. And then we use these smaller trocars out laterally on the abdominal wall and to facilitate grasping the gallbladder in order to perform the operation. And this is a classic kind of instrument which we use to grasp the gallbladder.
I think it's important for our viewers to see how small that is, that if you put your finger next to the end of that is a very tiny instrument, and you're going to be manipulating those instruments from outside the body.
Correct.
And watching a television screen and doing all of these things.
So we have two screens in the operating room, and the person standing and doing the operating, everything is in proper direction, and it's quite easy to operate. The person standing on the opposite side of the table sees everything in reverse, so you have to picture what you're going to do in reverse also, mentally. Nintendo is a good way to learn how to
get coordinated. That's good. I like that.
Right.
Great. Well, I know that our viewers are ready to see this fascinating procedure, so let's leave my Skin and Allergy Medical Group studio in Yuba City and walk 1 block west on Del Norte Avenue to the Fremont Medical Center as we continue our Medical Explorer from Dr. Rossen's operating room.
All right, I should introduce everybody here, perhaps. Dr. Del Perro is the anesthesiologist, and then we have Dr. Fuller is going to be my assistant, and Regina Marks will be the camera person, and Chuck is our scrub tech, who is a Dallas fan. Can you believe that? And Chrissy back here is going to be our roust, and our patient is going to be a patient who is consented to have her gallbladder removed through laparoscopic means. And we'll start by making an incision just below the umbilicus. And if you get fainty, just let us know so that you don't. So that you don't fall. Okay, a couple pumps. And all I'm doing now is just dissecting down to the fascia. Let's have an arming, please. Now we're going to be in the peritoneal cavity in just a second.